And he's now, those who haven't had the opportunity to be part of this training via this telemedicine system, we have another training coming up that the regions are going to select the persons who are not here to undergo the same training. So this training here is something that all healthcare workers would have to do, but at least at this first time, we're using the telemedicine platform to do the training. So in general, the purpose of this training is how to use the new system that is in place. It is not active as yet because we will have a date which we will tell you after the end of the training of when it will be active and when you can start entering the information in, meaning that not just information that is happening at this time, but information that you probably had from the beginning of January to this time using this system. This system is going to be the only official national collection system for suicide deaths and suicide attempts, meaning that you would have to use this particular platform to do it because this is the one that is going to cut across all agencies. And just to let you know, this is not just on a broader perspective, this is not just only information collected from the Ministry of Health, but we would be collecting from other agencies like the police, the Guyana Police Force. All right. So it's not just the public health facilities that you're from, but also the Guyana Police Force, and we're also getting it from private hospitals too. So just to give you an overview is that the information coming from various sources is going to help us to accurately pinpoint what is going on. Right? Now, the community health workers that are there, you would appreciate that you would be working in the communities with the community leaders, either indigenous or non-indigenous communities. So even information that you would receive from them, once it is you're getting it from those people that you normally get these reports from the of the suicide deaths or suicide attempts, this is something that we encourage you to enter as normal into this system. Like I said, this system is not difficult to use. It's very simple, but the idea is that we get the information in a timely manner that we can use to intervene very quickly. For example, if we have a suicide attempt before it ends in a suicide death, we would know, well, hey, this particular community, this particular region, they need assistance or they need help because something is happening. So that is the idea in a nutshell of this system. And it is a national system, and you guys are the first to be part of it. So I would like to thank you all for sharing your afternoon with us to be part of this training. And I would pass you over to Dr. Natasha Sobers from PAHO WHO, who would be assisting with the next part of the training. I will be back for the question and answer period of if it is that you have any questions or clarifications, I'll be happy to do so at the end of the training during the Q&A period. So thank you so much, and I would hand you over now to Dr. Sobers.
All right, good afternoon, everyone. Thank you very much for coming on. Dr. Morgan has really given us a very good background to the system. And we at the Pan American Health Organization at PAHO, we're very, very pleased to partner with the ministry in supporting them and rolling out the system. So what we're going to do, we're going to talk a little bit about some of the reasons that we have the system, and then we're going to get into actually using the system. So we're going to send you a link, we're going to start to use the system, and we're going to look at some of the cases. So as you know, Guyana has relatively high rates, and the ministry has been doing a lot of work with suicides and mental health. But the thing now is to understand are any of the things working, or what's happening, who needs help the most. So that's why we need data. That's why we need the system. That's why we need to understand who is affected and so on. In developing the system, we use the World Health Organization's framework, and we are using a system that has been developed. It's been used in India, it's been used in Thailand, it's been used in other parts of the world as well. And we've just adapted it and make it very relevant for Guyana. So in this session, we're going to talk about the purpose of the system. We've heard a little bit about that before, the legal aspects, how it's structured, and then get into the meat of the matter with the data collection. So we want to track and document the occurrences of suicide, We want to be able to look at suicide attempts, and we're going to do it in a centralized database, everything all in one place. We want to be able to look at trends, know what's happening in region 1, are all the deaths happening in region 10, or are all of them happening in region 6? What's happening by region? So we want to identify and analyze the trends by receiving data from all of the regions. And then that will help us, of course, in deciding what the interventions are going to be and who we need to intervene with. Dr. Morgan spoke to the fact that this is in the Suicide Prevention Act. So the Suicide Prevention Act speaks to the fact that if you are aware of someone who has died by suicide or had a suicide attempt, then you have a legal obligation to report that incident within 24 hours to the relevant authority, which is the Ministry of Health. And while you have to report, the Ministry of Health wants to make sure that all of the information that's reported is confidential. So that's why we're using this particular system that we're going to show you today. All right, so who is involved? Lots of persons are involved, but the main person team I want you to take away from here is the mental health unit will be the coordinating unit, and the statistics and surveillance department of the Ministry of Health. So they are the leaders of the system, and then all of the health facilities, police stations, and so on within Guyana will be giving information as well. And there's an entire standard operating procedure in order for persons to understand what's happening. Okay, so data collection, that's what we're really here for today, to understand the data collection and what's happening. So as we said, we want you to be able to collect the data and by a red cap form. This particular form right here, this is the form that we're going to be collecting data. Can you see that form? Can everybody see the form?
Yes.
On the screen? Yeah, just by nodding, thumbs up.
Yes.
Yes.
Yeah, okay. Right, okay. So this is the first thing that you're going to see when you click on the form, on the link that we're going to send you shortly. And you will see that the first thing the form says is that it aligns with mental health policies. It is in alignment with the Suicide Prevention Act. The data is being collected in a confidential manner. And the first thing the form asks you is, was there a case of death by suicide or attempted suicide in the last 2 weeks? That's because we would like you to indicate whether there's a death by suicide. So we want you to look up for the cases of death by suicide, but we also want you to report every 2 weeks to say, hey, we didn't hear about anything in the last 2 weeks. We didn't hear about anything in the last month. But we're still reporting to say we did not hear anything. You have to report which region you're reporting from and what location, which health facility or what police station and so on. So this is the essential parts of the form. But notice the first question is, was there a case? So how do we know what is a case and what is not a case? You might say that is fairly easy. Deciding on a case, the person first of all has to have an injury or poisoning that's self-inflicted. If it's not self-inflicted, then of course it's not suicide or suicide attempt. And it also has to be intentional. It can't be an accidental case. So it has to be an intentional, self-inflicted injury. And now we're going to go through some examples of cases. That's why I need you now. Doctor is going to put in the chat some examples of cases, and you're going to tell me if these are cases or not cases and how you would report them. If you would report them suicide, attempted suicide, or is this not a case at all? So first case, Doc? Yeah, we're going to put this in the chat. So look in the chat, your general chat, and see if you're seeing this case. It says a key informant, in this case is a religious leader, advises that a 43-year-old man in the community was taken to hospital by his brother after ingesting paraquat, pesticide. The key informant was asked by the family to visit the man during his hospital stay. So now we know he was admitted. The family communicated to the key informant, the religious leader, that the man has separated from his wife. He told his brother how pointless life seemed, and there was no reason to live without his wife. The key informant is unsure how much pesticide was ingested, but it is known that the man died in hospital. From the information that you're given, would you call this a case? Would you register this one? Is in the chat now? Oh, yes. So everybody can say yes or no. Is this a case of suicide, attempted suicide, or no? Would you register this or not register?
Guys, it's in the National Telemedicine group. It's on a poll. You can click yes or no, and we can see our answers there on WhatsApp.
So read the case. You can see the case on the screen.
Let's give a time limit. Let's give 2 minutes. Great.
Okay, I'm seeing your answers. Very good. Thank you.
1 minute.
Mhm.
So we give you 1 minute to answer the question, right?
All right, very good. I'm seeing the answers. Thank you very much. Everyone is saying, yes, this is definitely a case. Okay, great. Case number 2, an emergency department presentation is recorded in the healthcare notes. The clinical notes state that a 28-year-old woman presented to the emergency department via ambulance at 2:30 on Thursday morning. The woman presents as heavily intoxicated, so she drank a lot of alcohol, and she said that she took a lot of Panadol, paracetamol, and that she felt there is no point to living because she is worthless. She then called the ambulance herself and immediately attempted to clear the contents of her stomach, which means she vomited it up or put her finger in her mouth and tried to get out everything. She has a diagnosis where she had previous depression and she's tried to harm herself before. Would you call this a case or not a case? And remember that she's saying there's no point to living, but she's also immediately clearing the contents of her stomach. So is this an attempted suicide or is this not an attempted suicide? And this one I'm going to ask case 2. So I'm seeing some answers already. We're going to give some time for that as well. We're at 32. We're going to give 1 minute for answers. And then I want to hear from at least one person why you say that this is a case. It's case 2. Yeah, good. Because somebody could argue that maybe she didn't really want to take her life since she cleared the contents. Well, why would you call this a case? And everybody's saying yes. Anyone? Let me just say that I completely agree with you. It is a case. Okay, that was the 1 minute. Okay. So in this case, even though persons may argue that she cleared the contents of her stomach, this is definitely an intentional self-harm. And that's really all that's needed in order for this to be a case. Intentional and self-inflicted. She did it to herself and she intentionally tried to hurt herself, even though afterwards she maybe regretted it and said, oh, let me clear the contents. So this is still a case, and definitely it should be reported. Case number 3. 15-year-old boy. He comes in with an injury to his neck and laceration. His mother is with him, and she says she found her son hanging from the window on a blind cord. So she found him hanging, but she's explaining that his foot went through the glass, and said that she sent him to clean the windows, heard a noise, and heard the breaking glass, and she found him hanging. So is this a case or not a case? The boy is in shock. He said he slipped, he's shivering, he's upset. Is this a case or not a case? This is number 3. I'm not, I will at least one person tell me why this, this is case 3. I'm seeing no's. Why is
Good
this not a
afternoon,
case?
because it was unintentional.
Because it was unintentional. So it is, in a sense, self-inflicted, but it's accidental hanging. Right. Okay, great. Thank you very much. Let's move on to 4. 17-year-old girl presents to her nearest health center with abdominal pain in the left shoulder and left chest. She has breathing difficulty and nausea. She began to vomit and get faint at home. Her mother looked at the stomach and saw extensive bruising, and reports that her daughter admitted she had been punching herself in the stomach. The girl is frightened, she's crying, she's anxious, and she keeps saying, "I'm sorry, I'm sorry." Case or not a case? People also are putting their answers in the chat. Yes. Okay, yes, some people are. So I'm now looking at the answers in the chat. Very good. Yes, and some person said that earlier, but they said yes because she has a major depressive disorder. Okay. Case 4. Okay, everybody's unanimous on that one too. Case 5. Recently widowed lady presents with minor burns to her large body, to a large part of her body. She denies self-harm. She says her in-laws made her do it to herself due to an inheritance dispute, but she ran and rolled on the ground. Her sister helped her to get to the hospital. She's nervous and quiet and is afraid of her in-laws. What do you think? Are you going to report this as a case or not a case?
Not the case.
I'm hearing not. It's 5. Mhm. Any yeses? All right, so I was saying all no's. Why did you say not a case? The persons who said not, somebody said not a case. So I see 1 yes. Why did you say not a case?
Because is somebody else do the harm to her, not she do it to herself.
Okay, if you're because yes, she's burned and so on, and maybe she had a part, but they made her do it, or somebody else is doing it to her. Yes. All right, so our last one is this one, 19-year-old male with a bullet wound. I'm going to skip to case 7. Sorry, 7 on this one. A 19-year-old male with a bullet wound to the leg. He's accompanied by the police who say he was pointing a gun at them and using threatening language with the police. They asked him to drop his weapon, but he refused, so he was shot in the leg. The gun was removed and was an air gun. He's agitated and still swearing. He's restrained by handcuffs, and he has a history of admission to the hospital for bipolar depression. Case or not a case? I see one yes. Case or not a case? I see one no. I'm definitely going to give you a full minute for this one because this one is not straightforward or not as straightforward as the others. So I'm also going to ask somebody who says yes and somebody who says no to tell me why you're saying that.
I'm saying yes because remember he was already been he have a history of bipolar depression, which is a type of depression.
Mm-hmm. So you're saying yes
So
because he has bipolar depression, but what happened to our criteria where we say it has to be intentional and it has to be self-inflicted? What happened to our criteria? Intentional and self-inflicted. So based on that criteria that we put forward, is it a case or not a case? So I see some no's. I see actually it's quite divided. Some 4 say yes, 3 say no.
Is yes, it's a case.
Okay, go ahead. Go ahead. Go ahead. Denisa, why do you say it's a case?
Because he would have known that well, he would have obeyed to the police officers or so,
Right.
but no, since he just loves harm and he loves harm coming to his way, because anybody in the right sense would have known like it's okay, it's good to obey.
So
And
you're
if you
thinking that,
don't obey, you have to get shot.
right,
So he would have seen that coming,
right,
It's
okay,
just my
okay,
opinion.
okay. So you think that he
Uh,
saw the police, he saw that they might shoot him, and that he I don't want to say promote it, but he was okay with it. So you're saying yes, it's a case. Anybody says any of the person? So I know we're lots at 4 and 4. Who says no? This is not a case. Denisa told us why she says it's a case. She thinks that he almost intentionally wanted to get shot because he should have obeyed. And who says no, it's not a case, and can you defend it? Let me see if anybody's written in the chat. Oh no, that was from the last one. Nobody willing to defend it? Well, the thing is this is intentionally ambiguous, meaning